So today we are going to be talking about all things PCOS, hormones and fertility. So as you hopefully know, this is my husband Arjan, and he has become very clued up about hormones and that side of things. So we are just going to be covering a few topics just as a bit of an introduction, and then, as you obviously know, follow this page for even more information coming up as well. So Arjan, what's your first question that you may have for me on this?
So I think the first thing is really around PCOS and just a general understanding of what that is and what that means for people.
Yeah. So I guess actually we've got PCOS, but there's also things like PCOD, PCOM. It's not just about the S side of things. Right. And with it, there's actually a lot of ladies who are not even diagnosed with it. So what typically happens is someone may go to the doctor, go to the GP. They may be complaining of irregular periods, having excess hair growth on their face, really difficulty in losing weight, may have really bad mood swings. But when you go to the GP or the doctor, they may just say, okay, we're going to do an ultrasound, we're going to do some blood tests, or they may even do none of it. They may dismiss it, or even worse, they may just put you on the pill to start off with.
Okay, so what are the main sort of symptoms? People, excess weight, was it? And
yeah, so typically it can be excess weight gain and body fat around the stomach area. Ladies can complain of excess hair growth, especially around the face. So it's where like men would typically get hair, so around like the beard area, moustache area, underneath the chin, around the stomach area, arms, legs, you name it. Also having acne, so that can be quite extreme. Even things like having dry skin, so dandruff, excess mood swings, low mood, depression, excess appetite. The list is endless, sadly, with ladies who have PCOS.
So it sounds like it's an all-encompassing problem in the sense that it's not just one thing. It's not their weight. It's their appetite, their mood, their energy.
Yeah.
So how do you get a diagnosis? How do you know if you have it?
So the one actually I forgot to actually mention is the irregular periods, which is also a really big sign as well. So sometimes you have these things and you'll just know that you've got it. But the best way is obviously to get a diagnosis from your doctor. So to speak to them about these are the signs, the symptoms that you're experiencing. And what a doctor will typically do is refer you for an ultrasound. But that's not actually the only way that you can get diagnosed. So what happens is there are two types of ultrasounds. One is where it's a bit like if you're pregnant, they do it just on your stomach area. They put a gel in that area. Another way is doing it from the inside, so a trans vaginal ultrasound, and that's where they can basically see that you've got fluid-filled follicles, so cysts, on your ovaries. You may have it on both sides, left and right. You may have it on one side, and the size can really vary for each person. So some people, it can be quite small. Some people's cysts can be quite big, and that will determine the severity of the PCOS. Another way is actually having blood tests done, but a common mistake that GPs or doctors may make is they may not tell you that you've got to get it done on a set day of your cycle. So sometimes ladies may just get blood tests booked in, they have the hormone levels and things checked, but they've got no idea of where they're at in the cycle. And typically, if you have PCOS, your cycle is not regular. So it's not going to be your typical 28 to 35 days. You may have a period twice a year. You may have a period 4 times a year. So I know for me, I only had it 3 times a year, and it was very unpredictable. So you had no idea when it was coming. You thought it would be coming from like your mood swings coming up, from your appetite increasing, and it would just be very unpredictable. And then when you did have it, it could be really, really heavy. Your energy levels could be low. You could have really extreme pain. I remember actually fainting because the pain was so bad. And I also remember having to miss work for 2 days because it was just so awful. The flow, energy levels were so low that it was just really hard to kind of function on a day-to-day basis. And especially being a dentist, you don't want to be doing a filling on a patient fainting because you're in such extreme pain. So it was quite hard to kind of manage. But a lot of the time, doctors will think you have to have the cyst on your ultrasound. And actually, if your blood test is showing, say, for example, that your testosterone is elevated, then that is a clear sign. If you've got irregular periods, that's a clear sign. So now what we need to kind of be aware of is you've got to look at everything together. And it's really like a lifestyle condition more than just you've got cysts on your ovaries, you've got it, versus looking at all the signs and symptoms that we've looked at, especially like the excess weight gain, the irregular periods, having elevated testosterone, DHEA, DHT in your hormone levels, and it's just being aware of all of that as well.
Fine. So it's not like I have this one symptom, therefore I have it, or I don't have this one symptom,
Yeah,
so I don't have it.
Yeah.
It sounds like it's a whole host of different things that you probably need to have a few of these things happening to come up with that diagnosis.
Yeah. And also as well, it may be different on different months or different years. So if your hormones are completely out of control, you may notice on some months your hair growth may be excessive, even worse, versus other months. So again, it's quite important to actually even think about keeping like a bit of a diary, a bit of a journal of what is going on. And it can also be massively linked to your lifestyle. So in terms of what you're eating, what you're drinking, your stress levels, your sleep, and also keeping a bit of a diary on how like your mood's been. Because sometimes people can think, oh, it's just linked because the weather's not good. So they may say it's like seasonal affective disorder, but it actually could be your hormones versus anything else as well.
Sure. So you said that the periods become really irregular. Would that then have fertility problems or cause fertility issues?
Yeah. So a lot of the times, unfortunately, ladies can leave it a bit too late. If they're thinking about having children, they kind of wait to go to the doctor if they've had an irregular period when they're ready to conceive. But what you need to remember is if your periods are irregular, your hormones are irregular, and it can actually take around 3 to 6 months to get them back into sync. And that's actually if you're doing the right things. So unfortunately, one of the first things a doctor or a fertility specialist may say is you've got to lose weight or your BMI is too high. So typically what ladies may do, they may do something like, try and lose weight by themselves, get a personal trainer. And what that person may do is they may put you in an extreme calorie deficit just to get your weight off. But what can often happen if you're doing it in a non-sustainable way or you're not doing it in the right way, that can actually set your hormones off even more and imbalance them even further. So actually trigger you to have way worse fertility issues. So that's when it's really important to be aware of that when you're trying to lose weight, it's actually to do with balancing your hormones, because if your hormones are balanced, your weight will drop quite quickly. And it's not actually to do with the BMI a lot of the time. That's what the doctors, the clinics will say, because it's a very easy metric. But if you think about what BMI is to do with your height and your weight. So if you're like me and you're 5'1", your weight would have to be like quite low to be able to have a good chance for fertility. But the experience that we've had with the ladies that we've coached is actually if we're able to trim your body fat down, because that's what's going to be the thing that triggers the health issues or having diabetes or things like that. If we can really get that body fat off the stomach area, your body's actually, the hormones are going to be running quite effectively. They're going to be quite efficient. Weight will start dropping, but then your chance of fertility will increase. And actually, you may not even need to be in that correct BMI range, and you may still able to get a successful result. So if we think about what infertility means, it's if you've been actively trying to have a child for a year and you've not succeeded, that's what the doctors will class as your having fertility issues. But again, doing it for a year, it depends on how old you are. So if you're 30 years old, the chances are going to be different if you're 35 years old, to if you're 37 years old, to if you're 40 years old. So a lot of the time, again, like you can go to the doctor and they'll say certain things, but you really do need to have an awareness, and you do actually need to start thinking about this sooner rather than later, because your chances can decrease as you get older. And not only that, your chances of having like a miscarriage or things like gestational diabetes or, the baby having Down syndrome and things like that, all of that can change and increase as you get older as well.
So you said that sort of balancing the hormones will then help with fertility.
Yeah.
Is it a case of then, do you have to shed all of the weight first to then be balanced, or can that start happening sort of sooner? Because it will take time if somebody's like a really, really high BMI to bring them down into normal.
Yeah.
Is it possible to like shorten that, or what's the?
Yeah, that's a great question, actually. So when you're managing the hormones in your body, naturally your weight should be coming off if you're doing the correct approach. So what I would always actually say is prioritize balancing your hormones, and then your body weight, your body fat will start coming down, and then that's going to help increase your chance of fertility.
Okay.
Because if we think about it, if your hormones are imbalanced, naturally your periods are going to be very irregular. So if we're doing the right things to make that regular, then everything will fall into place. But also, actually, if your period isn't in the 28 to 35 day cycle, it actually means something in your body is not healthy and something's not functioning well. So it's not even if you're just thinking about fertility, you think, oh, I should be having a regular period. That's actually incorrect information. If your period is irregular, it means a lot of things in your body are not functioning well. So it could mean that you're having insulin resistance. It could mean that you've got digestive issues. It could mean that you've got gut issues. It could mean that you've got mood issues. So you're more likely to have depression or borderline mood and things like that. So it's actually worth being aware that all of this is linked. It's not just hormones, it's also gut health, it's mental health, it's physical health. It all actually ties into one. And then also if you're bloated, it means that you're going to have gut health issues, which means you're going to then have a higher chance of fertility issues because then your hormones are not linked. So it's really worth being aware that it becomes a health situation, not just I've got to lose weight because that's what my doctors told me, because then you may do it in the wrong way as well.
I mean, you say that, but like losing the weight, it seems now so tempting. I can just take an injection, Ozempic, and there's another one, Manjaro.
Yeah.
If I just have this injection, then I'll be able to lose the weight, and then that will help me, or help a lady balance their hormones.
Yeah.
So is that not something just to consider? Just take these super injections and then Bob's your uncle.
Yeah, so actually GPs are suggesting and even prescribing to do things like that. But what we need to remember is, how do these injections work? So if we think about Ozempic, Mounjaro, what we've got to remember is they're appetite suppressants. So weight will go down because you're actually going to be losing muscle mass. And as we know, if you're losing muscle, it's actually going to have a long-term impact. So especially if we think about menopause, metabolic health, thinking about your metabolism side of things. So yes, weight will come down, but you will also start to look gaunt. You're also going to be losing your muscle mass. So think about when you're 80, you're going to really struggle to be able to get out of your chair because you've just wasted all your muscles away. And also your energy levels are low because your appetite's lower. So if you're not eating much, how have you got the energy and the fuel to be able to do your day-to-day function? And typically, most people that we know, they're high functioning performers, like, they run businesses, they have professional jobs. Can you imagine knowing that your doctor, your dentist, or your optician, your pharmacist, someone who's doing something like prescribing your drugs or doing surgery on you, is taking this injection? What is their energy level and their mindset going to be like? Like, surely mistakes are going to start to be made. And with anything where it's a quick fix, what happens when you come off that injection? You've not really made that behavior change. You've not made that change of identity to then be able to maintain your progress. So yes, it will work during the moment, but what happens when you're off it? And if we actually look at the long-term, research, the evidence-based stuff, if we look into the BNF of how many interactions and issues are with these injections, and also if we think about the recent death that happened of the nurse, a medical nurse who was taking this injection, she died from it. But all of this stuff doesn't ever get shared. You always see the success stories of, oh, so-and-so lost weight really well. What do they do? Oh, they just use that injection. And now it's actually becoming a bit secretive. So we're finding partners are using it. They can't even have that honest conversation with each other. People are finding that weight loss injection in the fridge. Weight is then getting, coming off, but you have no idea what's going on in the body, what are the long-term effects. And I think we're very about living in the moment. No one thinks about, oh, in 20 years' time, what happened? A bit like COVID injections, in the time, what happened versus the long-term effects we're learning about now. It's all a bit crazy, if you ask me as well.
I think the interesting thing you said there was the injections cause you to lose a lot of muscle mass.
Yeah.
And then that's definitely not going to help in terms of somebody with a hormone condition.
Exactly.
And then if you're a woman as well and you lose the muscle mass, that's going to have an impact during menopause, right?
Yeah. So when you lose muscle sarcopenia, what happens is you're basically wasting away. So if you think about common joints that you can get pain and discomfort in, like your knee joints, even your elbows and things like that, your knee is a load-bearing joint. So when you're walking, and you haven't got the muscle mass to protect it, you're going to start to get a lot of pain. So what happens, especially in like menopause, because your hormones are changing, your estrogen levels changing, what can then happen is you've got higher risk of osteopenia, osteoporosis. So that's essentially when your bones can become weaker, they can become brittle. So you could be walking up a flight of steps and you can trip and you could break a bone. But if you've not got that muscle mass and you've not got that strength around it, it's going to lead to a bigger impact. So say, for example, if you're 40 years old, 45 years old, you love going on active holidays. So you love doing things like hikes or treks or even just being able to like walk to a waterfall. If you fast forward and you're at 50 or 60 and you've been taking these injections or you've not got the right muscle mass, you're not going to be able to do those things. So yes, in the moment, you may look amazing. You may have like a gaunt face from like using that injection. But have you thought about what's going to happen when you're 50 or 60, especially if you've got kids? What's the long-term impact on that side of things as well? And as we know, muscle mass helps increase your metabolism. It helps reduce your risk of like higher cholesterol, helps reduce things like blood pressure issues. And as we know, like, it's becoming normal. Like if you ask, or even if we think about how many people that we know that are taking medication for cholesterol, for diabetes, for blood pressure, it's
scary, isn't it? We've got so many friends and family on a whole cocktail of things now.
Yeah.
And the interesting thing was how they just normalized it. It's like, oh, I've got a little bit of high blood pressure, so I have to take this.
Yeah.
And they don't think anything of it.
Yeah.
It's really scary. Or, oh, my doctor said I'm diabetic and if I have this tablet, then, my blood sugars are fine.
Yeah.
So I'm just taking this tablet and then, carrying on.
Yeah.
And then you'll see them scoffing a cake and think, what's going to happen fast forward 5 years, try and explain it. And it's really, really tough, isn't it? It's
I think as well, like when you get diagnosed with it, because number one, you've normalized it because everyone around you seems to have it. You don't really make that lifestyle change. But the second thing, I don't think they really talk about like the long-term impact. Say if you've got diabetes, like it's not, oh, you should get your eyes tested because they're at risk. You can actually go blind. Or even like with teeth, like gum disease can get so extreme that your teeth can actually fall out. And it's not as easy as getting implants or going to Turkey and getting turkey teeth. The implants are just not going to work. Or it's, the risk of your leg having to get amputated because of your diabetes is so uncontrolled.
Really high blood sugars, and then you get all these issues, problems, right? Your eyes, your extremity, your fingers, your toes, your lower limbs.
Can you imagine not having teeth?
Yeah.
Like, how can you eat all that food?
Well, maybe that will help with the diabetes.
Yeah. But also, I guess if we think about it, like a lot of the times people say, oh, it's because I'm Asian. And actually, if we touch on that, it's not because we're Asian, it's because of the foods that we're eating. So same actually with PCOS, a lot of people will think it's a genetic condition. So I often hear someone will be like, oh, my mum has it, my sister has it, it's normal in our family. But it's actually to do with the food that you eat or the activity levels. So I know in my family, we were all obviously brought up in the same way. So we would have eaten the same foods. We all used to go out the same amount. That would then get carried on in what our lifestyle is, what, people who have children is and stuff like that. So it's really actually worth honing in on. It's a lifestyle condition, and it's on us to be able to control our lifestyle. It's not, oh, it's genetic and I'll never, it's going to happen anyway. It's no, you've got that control, and you can control it with your food, with your behavior, with your habits, with your mindset, with your exercise, and you can actually change that outcome, which is really important as well.
That's awesome. So I think the key bit there is that you can change the outcome
Yeah.
with doing certain things and changing how you approach certain situations and certain things in life.
Yeah.
So that behavior change sounds like it's quite important.
Yeah.
It's really tough though, right? In today's day and age, we've got like everything at the click of a button.
Yeah.
Sitting there scrolling on your phone, and before you know it, it's been an hour.
Yeah.
I think like come dinner time, I spend more time deciding what to watch on Netflix and actually watching it. There's so many things that are sort of taking our sort of brain power and our will, and these little, like, do you have any opinions on that?
Yes. And if we kind of compare back to, let's say 20 years ago, right? So I remember, obviously I'm probably showing my age, but you'd go to school, you know what you were going to have as your snack afterwards. Dinner was practically very similar every single day, like being Gujarati, it was your rotli, your shak, your dal, your bat. You knew you were going to watch EastEnders in the evening. It was quite like, you knew what was going on. You didn't need to decide anything. You knew, Phil Mitchell was going to pick on Ian Beale or something like that. And I guess now it's so different, because also, like, it's okay, everyone wants to eat different foods. Everyone's a bit fussier. What do we watch on Netflix? Then we're there scrolling. Think of how many thousands of thoughts are going in. We're looking at what so-and-so did on the weekend. You're looking at what someone wore. You're looking at what restaurant they went to. You're looking at then an influencer telling you how to lose weight, someone telling you how to manage your hormones, someone telling you you've got cortisol issues. No, you've got insulin resistance. No, you've got sleep issues. So it's constantly that scrolling. And I guess if you actually look at your screen time, so how many hours a day you're on a screen. I know we did this with our clients, and I think the average was like 6 hours a day. So imagine, like, comparing back to 20 years ago, that 6 hours of extra information where your brain is just processing things and you just basically can't even switch off. And then the weekends are jam-packed because you're comparing to what so-and-so's doing and what they did for their kid's birthday party. Someone got a unicorn, someone got, Elsa dressed up as a Disney princess. And the society that we're now going into is really like stressful, and we just can't switch off. And that also has an impact on our hormones. So if we think about perimenopause and menopause, a lot of ladies are actually getting that earlier on in life. So before it would be, 45 years old, 50 years old, you'd be like, oh, someone's getting a bit moody, or someone's getting a few hot flushes. But now actually ladies are getting it at 30, 35. Then we've got like this whole infertility issue. How many people are going through IVF? And it's a whole massive host of things, like the stress levels. Women are prioritizing their careers. A typical woman's day is they get up at around 5:30 in the morning. They get into the office for 7, 8, 9 in the morning. They're coming home at 7 or 8 in the evening. They're still working till 10, 11 at night. And that's all while still going on your social media, doing all your other things. So if you think about what life is now versus what it was 20 years ago, what do you think is going to be like in 10 years' time? It's just becoming a bit of a nightmare, really, isn't it?
It's crazy, isn't it? It's crazy. Yeah. The social media thing and the sort of doom scrolling is a massive thing. It just takes up so much time and sort of bandwidth in your energy. Yeah, and the comparison to other people and what other people are doing. But then also there's all these influencers who are trying to sell you these supplements. So you can lose your belly fat in 30 days if you drink this tea. There's so much like misinformation, but you're basically being sold a lie constantly. And with the algorithm on your phone as well, if you click on it once,
that's it, game over. You're getting all these things.
If you watch that video for longer than a certain amount of time, you're going to get more of that junk, and then it eventually sounds as though it's
true.
Exactly.
Yeah.
And that's a scary thing. These sort of malaligned agendas.
Yeah.
It's a worry, isn't it?
It's becoming a crazy kind of world, but then it's also just having a negative impact on our health, because if you think about how important sleep is, if you're scrolling till late or you're watching Netflix till late, and then that then has an impact on your following day. So I know a lot of people will think, oh, sleep's not that important, but it's actually like laying the foundation for your following day. Because remember how we were saying it's not even about like calories in or calories out when it comes to losing weight. It's the type of food you're eating, even the timing of your food. So imagine if you're up late watching Netflix, you're snacking, you've had a pack of biscuits at 11 o'clock at night, you then go to bed at 11:30. What do you think the quality of your sleep's going to be like, knowing that you've had that excess sugar just before you go to sleep? What's that going to do on your blood sugar? What's that going to do on your heart rate? What's that going to do on your rest and recovery? And then, of course, the first thing when you wake up, you're going to go for something like coffee or caffeine, which is then going to trigger your cortisol level. But then you can't wake up naturally. So you have to wake up to a crazy alarm, which is the scariest thing in the world. So your mid-sleep cycle, you're waking up with crazy cortisol level elevated. You're then tired, so you're then going to have the caffeine to get you through the day. Then you go for a croissant or a sugar because you're so exhausted. And you then just think, why have I got health problems? Why am I always imbalanced? When actually you're not looking at your sleep, which is like the foundation of what meal choices or caffeine and things like that as well.
Crazy.
Kids. Yeah. Imagine like, I don't know if you remember, like when we used to be in clinic 5 days a week, how many cups of coffee would we be drinking? Like,
I would have probably about 7 or 8 cups of coffee. Maybe it was just an excuse to get out of the surgery room.
Yeah.
But I'd pour myself so many coffees. It's unbelievable. And then next to the coffee, there's always a tin of biscuits.
Yeah.
Right? So you can't have one and not the other.
Yeah.
Well, certainly I couldn't.
Yeah.
It's a scary thing, actually, isn't it? It's very.
And that's the thing, like, at work and you go into the staff room, it's like especially like around Christmas time, you're surrounded by all these sugary things, and it's so easy to overconsume on your calories without realizing. If you think about, if you went into that staff room 7 times a day, for example, you had a biscuit 7 times a day, for example, especially something like those Fox's cookies or those shortbreads, that's over 100 calories a biscuit. So before you know it, you've had 700 calories without even knowing. And then you're having, hopefully, lunch if you've got time for it. If you're not making time for it, you're elevating the stress level of your body. And it's just a disaster, really, isn't it? Like, think about what you're putting your body through. And then we hear about all these stories about people in their 40s, like either passing away, having heart issues, having a stroke. Stress levels are high. Food's really bad quality. And then it's just like a nightmare, really, isn't it?
It's a vicious cycle. So do you think then people should start getting blood tests and things like that and having a look in more detail?
Yeah, definitely. So I think blood tests are great to get done, but what isn't ideal is the way they get analysed, especially on the NHS, because what they do is they kind of put you in, okay, these are the average numbers, but it's not the optimal number. So when they run a blood test and they look at the average values, they'll compare you to the same level as like a 70-year-old inactive man or a 21-year-old woman, for example. And the range is so broad that if you're in the borderline bit or you're on the higher end, it should actually really depend on your optimal for like you as a human being, where you're at. And that's something that we massively hone in on, don't we, in our coaching? Yeah. It's like making
that's so
sure.
True though. It's like the range is so wide.
Yeah.
Right? It's either you're fine or you have disease.
Yes.
Whereas actually, it could be you should be here a lot, and the markers are out enough for us to be worried, but because you're not in the defined disease range, you're okay.
Yeah, because how many times have we had clients when they've sent us their blood test results, the GP said it's fine, and I'm like, you literally have you have diabetes.
Yeah,
like
you're a stone's throw away from metformin or some sort of diabetes medication.
But I guess because we look at it in terms of how does this person's body look, where's their body fat distribution, if they're holding all their body fat in their stomach, I'm sorry, but something is not functioning well. You know, you're going to be having digestive issues. Your hormones are going to be way off. You're wired, you know, you're tired all of the time. That doesn't, you know, it's not healthy just because your blood test said you're in the range. You've got to look at the whole bigger picture about things, don't you? About what is that person's lifestyle. Yeah. And that's why we're like more lifestyle health coaches versus anything else, aren't we? We're not your bog standard fitness, put you on a calorie deficit, you know, where we look at you as a whole and everything and
super important, right? Because if you just go on a calorie deficit, like you said, you're not considering what's going to happen with your hormones and what's at play. And that can have a massive impact.
But also like how your body's reacting. So your body may react differently to someone else. So that's why we're always like checking things, making sure it's all personalized, and just getting that constant feedback as well on everything, aren't we? So, and then retesting. We love data, don't we? We're always checking data like every single day.
It's so important. Retest, relook, see how things are moving, and if we're going in the right direction, what we need to reanalyze and change. It's really important, isn't it? Otherwise, everybody's bodies are going to be different and react in different ways.
Yeah.
I wanted to ask as well about PT and stuff, because a lot of people think, you know, I want to lose weight, I need to get a personal trainer.
Yeah.
Or they don't get a personal trainer in some instances, and they'll do yoga or something because they don't want to get so strong, and like they don't want to turn into Arnold Schwarzenegger or the female equivalent. I mean, what's your thoughts on that? Is it sensible to do yoga instead, or is a PT the way forward? What's the...
You're spot on. So I even know, like, when I wanted to first lose weight, I thought I had to get a personal trainer. And if we think about it, like a personal trainer will typically charge like 40 or 50 pounds a session. If you have one session a week or 2 sessions a week, it's all about what happens in the other hours. So when it comes to losing weight, managing your hormones, it's actually to do with the food that you're eating. And the food has an 80% of your weight loss, your hormone rebalancing comes from your food. So if you're just getting personal training sessions and you're not looking at everything else, yes, it's a good way to stay fit and you know, get stronger, but it's not actually going to solve the problem. So what we want to think about is what's happening in all the other hours. What are your habits? What are your behaviors? What's your relationship with food? Have you got an all or nothing mindset? A lot of the time, these are things that we don't really talk about or look into. It's not as easy as being told, eat these foods and do this workout. If it was, everyone would be doing it. So it's actually learning about you. What are your habits? What have you kind of picked up from childhood? What are the things that you get drawn to? What are the foods you just cannot say no to? Can you portion control? Can you learn to leave food off your plate? Or are you that person who has to finish everything because that's how you were brought up? So if we think about when it comes to managing your hormones and losing weight, it is a lot more than just exercise. And also, like, is your personal trainer pushing you? Are they giving you different workouts just to keep you excited? Or are you going through that progressive overload? Are you actually getting stronger and getting, you know, heavier in your weightlifting? And it's a bit of a myth that you will get bulky. So when it comes to weightlifting, it's only if your food isn't going the right way that you may notice you're getting bulkier. So if you're overeating on protein and you're overeating on carbs, you will get bigger, because there are women who are bodybuilders and that's how they've done it. But it's not just from weightlifting alone. And also they're lifting really, really heavy weights. So,
and probably like 3 hours a day.
Yeah, they're really going for it. You know, they're following that structure. And of course, if you've got PCOS, your testosterone level may be higher, so you may build your upper body more than your lower body. But that's when it's so important to know what your body is like, and then actually having the right food advice and the right workout program for you, so you don't end up getting to that level. And yoga and Pilates, you know, it is good for strength, but it's not the same as resistance training and weight training, because that's what's building that muscle fiber. That's what's building the strength. It's also strengthening your ligaments around your joints. So then you're less likely to get joint issues as well as you get older. And I always kind of see like yoga and Pilates, it is still challenging, like don't get me wrong, but it's a good supplement to your weight training that you should be doing. And
what about cardio then? What about just going for like a long run instead of doing the weight training? Because if people that run are always skinny, so is that not a good way of losing weight?
So running and like cardio is good for fitness. So it's good for your heart health. But because you're running, and again, you're putting a lot of pressure on your joints, if you're not strong and you've not got the right muscle mass, you are going to get injured. So you've always got to, weight training should always be like your baseline. And I think people think, oh, I've got to spend an hour in the gym like 5 times a week. You can literally do like 20 minutes of weight training 3 times a week. And that should be enough as long as you're training properly. So you've got good form, good intensity, you're really pushing yourself. There's no reason why that shouldn't be enough, especially to get you started. So a lot of the time people overcomplicate it. You know, they think, oh, I can't do an hour, so I'm going to do nothing. And then we go into that whole all or nothing mindset. So we've really got to work on that consistency, and we've really got to think about all or something versus all or nothing. So it's just making sure you're not falling for those traps. You're not falling for the fads. Yes, you know, like Priya down the road maybe doing reformer Pilates or you know, Sonia maybe doing yoga and looking great. But what's right for your body, and what do you need to do to be able to get the progress that you want for health and for your hormones?
Yeah, especially because Priya down the road or whoever probably has a different lifestyle as well.
Yeah.
They probably have different nutrition.
Yeah.
Their body's different, and they've been doing certain things for so long.
Yeah.
So there's a whole host of other things to consider other than, oh, they do yoga and they look like that, so I'll do that.
Yeah. And also as well, like someone may look skinny, but maybe really unhealthy. So say, for example, you know, you could be looking in really good shape. They've not, you know, they can wear a size 6 or a size 8. But if you were to do a blood test analysis on that person's body, they could have like borderline diabetes, or they could have high blood pressure or low blood pressure, or they could have, you know, a risk of high cholesterol, but you wouldn't know, and you're basing your judgment by just looking at someone. You have no idea on actually they could have skinny fat, they could have a high amount of fat covering their organs, so they're going to have a higher risk of having a heart attack or a stroke. So it's so easy, especially as women, to compare to someone and think, oh, so-and-so is so lucky, they don't have to work out, you know, they can eat anything and they get away with it. But you've got no idea what's going on inside their body, and that's why it's so important to get these tests done and to actually think about, okay, what's my body going through? What are my risk factors? Where am I going to be in 10 years' time? So yeah, it's important not to compare to others, and it's so easy just to get jealous when you see someone eating cake all the time and they've never put on weight. Because I remember feeling that with a lot of people. And I think sometimes people think I can get away with eating a lot of food, but you don't know, obviously, the hard work that's gone into it in the years. And maintaining weight is very, very different to losing weight as well. When you're maintaining, can't even get my words out. When you're maintaining, it's a whole different world, isn't it? So
yeah. So true. Maintaining means you have to approach everything slightly differently. You're not on a weight loss journey, so you don't have to be in that massive deficit or worrying or thinking.
But you also don't want to get too complacent, because then it's easy to go backwards as well. So when people say, oh, you know, I worked with a coach and it worked, but I've just put on all the weight that I'd lost. And I'm like, well, it didn't work. If it had worked, we wouldn't be having this chat right now. If it had worked, you would have learnt to maintain. And that's something we're so hot on. Like, how many times do we get messages from people that we've worked with and they're still in the same shape, or, you know, they may have put on a kilo or 2, but they've never gone back to where they started. And that's damaging to your health. That's like being on an extreme yo-yo diet, if that's what you've done. Think of that time and money that you spent to to get there, and then you've just gone and undone it all just because you weren't taught about maintenance, or you didn't understand the concept, or you were just too worried to ask about it, or you thought, let me just save a little bit of money. I know what I've done it now. I know exactly what to do. But then you've got no idea how to manage an all-inclusive holiday. You don't know how to manage Christmas. And that's the difference with us. Like we're lifestyle coaching and health. So you're always going to be taught that as a priority versus anything else, aren't we? So
a key thing there, wasn't it? Is that it's that lifestyle change.
Yeah.
So you can lose the weight with a change of lifestyle, as opposed to being given a nutrition plan or a
spreadsheet.
A spreadsheet, yeah, or eat these 5 meals on repeat.
Yeah.
Some sort of meal plan, because eventually you come off the meal plan, or you stop dieting, and then you haven't had that lifestyle change. You were in diet mode. Whereas if you approach it as, this is the person I'm going to become, this is the lifestyle that I want to lead, then you can get a key sort of behavior change there, right?
Yeah. And just knowing like how to eat at your mum's house when she's made the food, or how to enjoy date night together and stuff like that. And it's heartbreaking, isn't it, when we hear stories from ladies who would be told, oh, I was told it was a cheat meal if I ate at my mum's house. And I'm like, what? That's mental. Like, we're Asian. We see our family so often, and that's how they show love, is food. So if you have no idea how to manage eating at a parent's house or going out for dinner, I don't know what you're paying someone to help you with. And that's crazy, the thing with our method. We have you can have 3 meals out a week, probably more than that actually. And it's just about learning how to do it for you. And it's what will work for you may not work for someone else. I
remember you being really upset once, and you were saying, I don't know their names, but somebody had just started working with you, and they'd messaged you saying, you'll be really proud of me. I was at my mother-in-law's house, and I didn't have any of the food that they made. And you think, you were like,
why not?
What's going on here? One, it's your mother-in-law, not your mum, so you can't even say, just leave me alone. You have to be, so it would have been a little bit more awkward. And then why are you not enjoying being with everyone, and
enjoying the moment? And
that's crazy.
And the worst thing is actually as well, like if it's like family, they always want to support you. So if anything, like you'd actually want to educate them, because then you're also helping their health out as well. Like why kind of keep your secrets to yourself and be like, I'm not going to eat that food. It doesn't matter if they get diabetes or if they get heart issues. It's actually be like, actually, do you mind making it in a certain way that still works? So it's just kind of including everyone in your journey to support you, and then you're actually helping them out at the same time as well. It's like the worst when sometimes we hear stories, don't they, where it's like, oh, I couldn't tell my partner I was doing this. And I'm like, what? Like, why would your partner not support you? Or when someone says, oh, my husband said it's too expensive. And I was like, your husband clearly doesn't love you if they don't want you to like be healthy. Like, what kind of relationship is this as well? Like, I guess like, again, like, as a coach, we kind of do go into a bit of like relationship coaching and stuff, don't we?
Well,
like
it's a lifestyle. So we have to think about everything, right? The person as a whole, and obviously everything in relation to that, their relationships, their relationship with food, their any gym anxiety. But I suppose a lot of people don't even go to the gym, right?
Yeah, but then also it's quite handy to know that you don't have to go to the gym, like you can work out from home. So it's quite, again, like when you know what to do, it's just really simplifying everything, because I think sometimes we overcomplicate it. We then get really overwhelmed. We then get so stressed that we end up doing nothing. So it's just so important to be able to like break it down into like baby steps, and then knowing that actually I can work out from home and see amazing progress, or even at the beginning, you could even see great progress without working out. But then the reason I love kind of talking about exercise and working out is not even just the physical side of things of like toning the body. It's like mentally that endorphin release, that you just feel so good after a workout. And for me as well, like, you know, when you feel stronger and you can get your bags out from the taxi, or you can pick up your shopping bag, or just the way your clothes fit, like your confidence, the way you stand, other people pick up on it. And then like, at work you go in, like I remember like my patients would pick up on it, because I was just able to sit with such confidence that like it's it's like life changing. I think that when you eat well, you exercise well, your energy is better, your sleep's better, you're not snappy. Because when you've not slept, you know, it's a nightmare. We're all just hangry and snappy and everything. And when you're able to communicate with your partner or someone about this journey that you're on, and you get that support, it's like magic, isn't it? It all falls into place. Imagine if you couldn't tell me that you were on a health journey, like what would that say about us? That kind of thing.
Yeah. Well, yeah. To be able to hide it from your nearest and dearest.
Yeah.
Yeah, that would certainly be an issue, and perhaps also very unsustainable.
Yeah.
In the super long term.
Yeah.
Because to make those behavior changes all of a sudden would be very odd.
Yeah.
Especially if they probably have some of the old behaviors.
Yeah.
And the old ways of thinking anyway. So you need them on side to help.
Yeah, definitely. No, I love that.